Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So, in communication skills in MRCPCH clinical exam, there are two stations of communications, and candidate is expected to perform actively and clearly engage with the role player. In exam, there are role players, and you should be in equal and open dialogue, and communication should be verbal, and also they will observe you in the non-verbal as well, like the body language, like your tone, facial expressions, and it should be in the concise manner and clear. So many candidates, they have lot of knowledge, but unfortunately they are unable to perform in the exam because of their communication style. So you will be assessed in the exam by your rapport and communication style. Verbal and non-verbal means verbal, you are how you will perform, how you will communicate your skills verbally, and how would you listen. You should have to be a good listener in exam. It's not like you will only perform, only you will give them information or breaking the bad news, and you will talk, and role player is only listening. No, it should be active communication in both parties. So information sharing and accuracy of information. If you will give them wrong information, you may lose the mark. So you have to give the accurate information. If you don't know, better not go for wrong information. Management concerns and agreeing for the next step, it is also important. You should agree at the end of the communication for the next step. If you are telling them about next step, they should agree about the next step. So these are the assessment areas in MRCPCH clinical communication stations. In each area there are 2 marks, so total there are 8 marks. So if you will lose each any one of them, you might lose the 2 marks. So you should take care. Each and every mark matters in the exam. So areas of interest, like the conduct of interview. So this is the thing which when you enter in the room in communication station, the major mistakes which candidates are doing, that they are not reading, they don't read proper scenario outside the door, outside the station. And sometimes they are mixing the name, like the mother name and the child name. They call the mother name with the child name. This is the exam, in exam stress. So the definitely it is for everyone, and this is a common mistakes they observed in the exam setting. So how would you cope this is how can you correct this mistake? You just mention, you must have the paper in the exam. You write the mother name and the child name clearly in your notes before entering in the room. So conduct of interview, it is how you conduct the interview. It's your capability, it's your skill, and this skill will not come you by reading. This is the performance. How do you perform, how much practice you are doing before exam. Appropriate explanation and negotiation. What does it mean, negotiation? Like if you go to the hypermarket, there are some salesmen, they will sell their product whatever you will do. If you have 100% idea that you will not buy, but because of their negotiation, because of their argument, because of their sales skills, they will sell their product to you. So you have to be in this manner, that you can tell the mother, you can satisfy the mother or the parent or the child in the in exam setup. Accuracy of information given, this is also important. You should have to give the right information, not the wrong information. What should have evidence based, means from the guidelines and the related books. And your body language. So some candidates, their body language is not like what they are talking. They are like sitting straight without anything, and no movement of the hands. There are no movements of the like neck and nodding, and if how they sit on the chair. These all things are observed by the examiner. And when you enter in the exam room, your time starts at that time. The other stations is not like that. The examiner will greet you, they will tell you, but in communication station, they will not tell you anything. You will go and you have to start. So your direct contact with the role player means whatever scenario it is, their role player. So body language is very important. So when you enter in the room, you should be confident, and your facial expression should be confident. Not you should not look in distress, even though inside you might have the distress, or you might have a lot of things in the exam setup, but outside you, no one can no other person cannot say that you are in distress, especially in communication station. Your tone and facial expression are important. Don't be a monotonous. You should have to focus on your tone, your facial expression, or according to the scenario, according to what you are telling them. Listening capability, this is very important, because if you are not good listener in real life also, this is the thing which many people are having the problem in the listening. So listening is very important. If you are interrupting the role player and you don't listen them, sometimes you know the answer of whatever what they ask, and from their half of their statement you understand that what are they going to ask, and you jump, you are not allowing them to complete their sentence, or they are not expressing their feelings, so you jump in between, interrupt, and you will want to tell them the answer. So this is the thing which can give you the negative marking. You should have a good listener, and I know it's not easy, but by practice you can get this good listener. Let them to complete their sentence, complete their expression, and then you should speak. And end of communication, it is also important that you will summarize, you will give them trusted websites, and also you will tell them according to the scenario, whatever scenario you have, according to that you should tell them about the next step. So indicators of effective communication. So before I am going to tell you, I will also give you the template which you have to follow in almost each communication, in each communication scenarios you can follow. So it would be easy. You must memorize by heart so that you will not lose the mark. So everything have the mark, like I told you, the repo and all the things you should have to, because some marks which is not by knowledge, by your practice and to memorize the thing. The other thing is the knowledge, which is the separate thing. So the without knowledge thing which you have to memorize, like the parrot, which will give you the good help in the exam. So before I'm going further, please subscribe my channel for further videos, videos which will help you in the MRCPCH clinical exam, and subscribe the channel so that you will receive the notification and it will help you to pass the exam. So indicators of effective communication are positive indicators and negative indicators. The positive indicators, like you should have to demonstrate an ability of negotiate effectively. Negotiate effectively, not ineffectively. You should have to negotiate according to the scenario, according to the role player's mood, and you should have to observe all the things. And negative indicator is unable to negotiate effectively. And positive indicator adopts a style of communication, as I told you: body language, tone, facial expression, your hand movements, the style of your sitting, how do you sit. So if you will fail this, you may lose the mark. And active listening skill, this is, you should have to demonstrate in the exam. Active listening skill, this is a thing which many candidates have the problem in the exam, and I would say that this is because of lack of practice. You need a good practice with any one of you and before exam sorry, and before going to exam, it's my advice to go for the mock exam so that the senior can tell you about your mistakes so that you will correct your mistakes. Show limited evidence of active listening, this will cause you negative marking. Express information clearly and concisely. Some candidates, they give the express information which is a lot of information. Even the doctor cannot understand, how the role player can understand, the mother or the father or the patient. So you should know what information is supposed, what information you should give, which can understandable by the candidate, which should understandable by the mother. You should not have the give the information which they don't understand. They know you have a lot of information, but you should give the information concisely and clearly, and should be understandable by the role player. And if you will have the negative indicators, have difficulty in expressing information a way that is easy and understandable for others. So positive indicators: check, understand, and summarizes effectively. And so you should have to summarize and effectively. Don't forget summarization. It has a marking of summarization. You should have to summarize effectively, and don't make assumption. This is also very important, that many candidates, they make the assumptions even though it is not written in the scenario outside, and even though the role player is not telling them, but they assume this should be. No, don't assume anything in the exam. All the things which is mentioned in the scenario, and all knowledge you have evidence based from the guidelines, from the books, that is the thing. Don't assume anything that this could have this thing. In all exam, in all station, not only in the communication. So there are six main patterns of communication in the exam. Number one is information giving. This is, you should have to give the information for about maybe a new treatment, for about the new disease, or the progressing of the disease, the progressing of the worsening of the disease, and you will give the new treatment. And the other thing is breaking bad news. How you should breaking bad news. This is the thing which is very difficult for all candidates. Even in the real life, the doctors are suffering with this thing. So this is not only for you. So breaking bad news about the new disease, about the drug error, about the anything, breaking bad news is a difficult thing, and you should know how to give the bad news. And this will come by the practice and the good knowledge. Consent scenarios, like you are getting the consent, and in consent scenarios there are many blenders, like the candidate are talking to them about everything, about, for example, if it is the lumbar puncture LP, and you told them about everything about the LP, but you did not say, you are unable to tell them that I need your consent for the lumbar puncture. So it's like you will cut your marks, they will cut your marks. It's not like that you have entered in the room and your task is to take the consent and you did not talk about the consent. So initially it's better to tell them, I'm here to take a consent from you, or at the end of discussion, I need your consent. So initially if you will say, even though you can say, and at the end you also tell them, I need your consent. So it's okay. So consent scenarios are also important to ask them about the consent. Critical incident, these are the things which are difficult for the candidate. Many candidates are having difficulties in critical incident scenarios. The other are ethics and the education. So these are the six patterns of main patterns of the communication stations. They can give you the, you should have to give the information, or breaking bad news, or consent, or critical incident, ethics, and education. So this is the template you should memorize by heart before going to the exam, and this template will help you in the exam. So first of all, you should know, you should memorize the 8 things: introduction, building a rapport, why are you there, what is your role, and clear the agenda. And you should ask about the previous knowledge, and ask for a company, means the but it is not in all scenarios. You should modify according to the scenarios, and be a good listener, be mindful of that, and find out secret of the scenario. In each scenario there is some secret in the scenario, so you should find out about secret of the scenario. And other thing is summarize at the end. So summarization is very important. These are marks for the summarization, trusted websites, and the 8 you should say goodbye. And these are the things you should have. This is the template for the exam, and you should memorize by heart. Like introduction, you should enter in the room and you will say, "Hello, I am Dr. Waqar." Then you told about you greet, hello, hello or hi. Okay, hello or hi, good morning. This is the greeting. Then you should introduce yourself, your name and your designation. I am Dr. Waqar, one of a child doctor here. Hello, good morning. I am Dr. Waqar, one of a baby doctor, one of a child doctor, one of a registrar. Whatever you develop the style, it's up to you. There are nothing wrong, right. There is no right and wrong how you will introduce yourself. But main thing is you should have to introduce without using a jargon. And you should tell about your designation, like already you told about doctor or the child doctor. So this is your designation. This comes in the introduction. Building rapport is the skill. It is not the thing which you will can give you, like how are you today. For example, you entered in the room, hello, good morning. This is Dr. Waqar. I am Dr. Waqar, one of doctor of looking after your child. So, how are you today, mom? How's your baby? So these are the words which will build the rapport. Okay, so after that, you will tell them clearly, clear your agenda. So many candidates they are hesitate to tell them. For example, that a child who has suffering from the cancer, for example, acute lymphoblastic leukemia, his chemotherapy drug is going on and he develops the fever. So you should tell them that because already role player know about their child condition because you read in the scenario. So they came for the follow-up, they came with the fever. So you should tell them that many candidates are hesitant to tell them. I came to know that your child, you should tell, say by the name. For example, any name of the child, Ahmad, Ali, whatever the name of the child mentioned in the scenario, that Ahmad is suffering from acute lymphoblastic leukemia. He is on chemotherapy and he develops a fever. You should tell them all the things. So they will know I am here to tell you about, we will discuss about this thing, whatever scenario accordingly. Previous knowledge, and this previous knowledge is important to know from the parent. By this, you may understand what, from where you should start. Ask for the attendant. This is not in all scenarios, because if there is a teenager you will not ask for the attendance, or there are parents, both parents are together, you will not ask for the attendance. There are some scenarios you will not ask for the attendant, but in others you could ask for it. But I don't think so. If you will perform well in all other areas, they will give you the negative marking if you don't ask for the attendant. So but they are saying you should ask, especially if there is a critical incident or some other breaking bad news. Especially in those scenarios, it is better to say. It will help you also to make the rapport as well. Be a good listener, be mindful of the time. So sometimes the role player is talking, and it's your job in the communication where to stop. You should have to be a good listener, but it's your job where to stop, how to stop in the respected way. You can tell them, I have a limited time. You can tell them that yes, I can understand, we will discuss because you should have to bring the role player to the focus of your task. Your task is very important. You should have to complete your task first, then you can tell about the other things as well. So secret of the scenario is very important. So you should have to find out the secret. Every scenario has some secret. For example, a teenager girl, a teenager boy, he has poor compliance. He is suffering from asthma, chronic asthma. He has repeated emergency visits with exacerbation and multiple times using of salbutamol inhalers and poor compliance. In that scenario, the secret is that he is a teenager. He started to have the smoke. This is the triggering. And if you will not tell him about the triggers of the asthma, if you will tell him about the triggers, these are the triggers, and you in between you told him about the smoking, you cannot say him directly that are you smoking. It's not the interview, you are explaining. You should have to tell them these are the triggers of the asthma. Then role player are trained, they can tell you, yes doctor, I am just, sometimes I smoke with my friends. Then you will tell him about, I would like to refer you to the smoke cessation clinic at the end. So by this way, every scenario has the some secrets. Every scenario has some secrets, so you should find out these secrets as well. At the end, you should summarize. Do not summarize all the do not tell them all the things of the communication, whatever you discuss with them. Summarization should be between two lines, between 1.5 line. It's not that you told them all the things. You should have the art of summarization and offer them about the trusted websites, leaflets, and at the end you should greet them. So this is the template. You should memorize it by heart and practice it, and by this you will have good communication. So information giving, I'll give you the one example. As I told you, I already gave you this example that uncontrolled asthma, ask about the concern and discuss each concern, ask about the risk and benefit, alternative management as well, and explore the secret of the scenario as I told you. If they are unconvinced, what you should do? You should tell them that I would like to refer you with your primary team, like the respiratory team, or arrange another meeting. So in communication, you should be mindful of ideas, concerns, and expectations. Some ideas like baseline understanding of the nature of the problem, how they understand about this problem, concerns, specific worries about each problem. What are their worries about each problem? If they are non-compliant of any medication, why? What is the reason? What are their concerns? In expectations, what are their what is the what they hope to get out of your communication, their agenda, what are their expectations. So sometimes in scenario outside you read that they want to meet to the doctor, but when you entered in the room and they said, I don't want treatment, I don't want or they are not talking to you, you should tell them that I came to know that you want to meet with the doctor, so I am here. So they want to listen you from this. After that they will open. And communication, it is a skill, as I told you. It need a lot of practice with your colleague, anyone, and you should have the accuracy of the knowledge. Sympathies and empathies are important. There are some words of sympathies and empathies. In my next videos, I might go scenario wise of communication. This is just for the introduction of the communication. So next videos I will start the each and every pattern of the communication, like the information giving, breaking bad news, critical incident, so that it will help you in the exam. And for the mock exam, you can contact me. This is my WhatsApp and the email. And before exam, if you will have the mock exam, it will give you a lot of confidence. And good luck for your exam. Thank you.